Hi everyone, my name is Suhani Patel, a 17-year-old teen and high school senior. Today I'm joined by Dr. Rasika Reddy, who's a dermatology resident at USC in Los Angeles. She did her undergrad at Washington University in St. Louis, went to medical school at UT Southwestern, took a dedicated research year, and is now back in LA for her dermatology training. A little fun fact about her is that she's passionate about Bollywood dancing, and let me just say, Bollywood dancing is very fun. I've done it myself. In today's episode, we'll dive into Dr. Reddy's path to dermatology, what life is like as a resident, and discuss unique considerations for South Asian patients in dermatology. Dr. Reddy, what inspired you to pursue medicine and why dermatology specifically?
Yeah, that's a great question. I grew up with a family of doctors. My mom's a doctor, my cousins and my uncles are doctors, and so I was exposed to it from a very early age. And then when I went to college, I actually didn't pursue anything in the sciences. I did anthropology major, and I saw that medicine and anthropology had a lot of connections because you kind of have to understand a person's name and story to really understand how to really help them with whatever medical condition they have and what socioeconomic circumstances they come from in order to be able to prescribe a good medication regimen that they would be able to adhere to and stick to and really get to know your patients in order to best treat and help them. And so I really liked the humanistic element of medicine. And then when I got to medical school, I was exposed more to dermatology. And I thought it was really fascinating because the skin is all over the body. I'm not just confined to just the heart or just the lungs. And it has so many interactions with other big parts of medicine that did interest me, like rheumatology. There's a lot of overlap, infectious disease, there's a lot of overlap, there's a lot of skin manifestations of infectious diseases. And so I thought it was the best way to be able to do one specialty, but kind of in a way dabble in a lot of other interests of mine at the same time.
Was there a pivotal moment that drew you into dermatology?
Yeah, so actually, as part of my anthropology major in undergrad, I had the opportunity to do a research project in India working with HIV positive individuals. It really showed me the humanistic side of medicine and how the patient's stigma or not being able to tell their families, how all of that impacted their access to care, even just coming to appointments, let alone being able to take or stay compliant on medicines. And so that made me really passionate to want to help these kinds of more vulnerable, more stigmatized groups within medicine in particular. And I think dermatology was the perfect balance of that because there are so many skin conditions, and because the skin is the most visible part to anybody, there's a lot of stigma and mental health concerns associated with skin conditions. And so I thought it was the best way for me to be able to feel fulfilled and help the kinds of groups I hoped to help in my career.
Did you always know that you wanted this field, or did it develop later?
I knew I had an interest in skin manifestations, but I always thought at first I would maybe do internal medicine and then, be able to interact with skin conditions through infectious disease or rheumatology, because, like I mentioned earlier, a lot of internal organs have some kind of manifestations on the skin too. And so I thought initially that's what I wanted to do, but then I realized dermatology kind of encompassed all of my interests without confining me to one subspecialty within internal medicine or another. And so that's why I thought dermatology was kind of the best of everything for me.
Can you walk us through your academic journey from Washington University to UT Southwestern?
Yeah, so I'm actually originally from Dallas, pretty much born and raised there. And so I knew that I needed to get out for college. I feel like everyone I knew went to the local UT or UTD. And so I just wanted to kind of forge my own path. And so I visited WashU in like a tour. And so I really enjoyed the people I met and the campus. And it was only like an hour and a half flight from Dallas. So it was really easy for me to come back home whenever I wanted or my parents to visit me. And while in college, even in high school, really, I have always loved volunteering and community outreach. So I did a lot of that. I volunteered in the hospitals, I volunteered tutoring different elementary school kids in the local communities. Like I said, I was an anthro major, and so that was kind of my main perspective into medicine, really. And so I kind of had a more unconventional path, some would say, to get to medicine because I didn't really study the sciences. I didn't really do too much research. I didn't really do too much in the hospital or scribe or anything like that. And so I think it was kind of a more interesting talking point for me when I was interviewing for medical schools because it kind of set me apart in a way from other applicants. applicants. And so I highly recommend to anybody applying for medical school and college right now to really just do what interests you and just be authentic to yourself because it'll really show and help you shine when you end up applying for medical school. And then in UT Southwestern, it was awesome to come back home. I grew up 20 minutes away from UT Southwestern, so it was always a dream of mine to attend medical school there. So it just felt very full circle getting to actually go there.
You also did a research year before residency, so what did you focus on and how did it shape your training?
hmm So like I mentioned, I was kind of dabbling between internal medicine and dermatology and decided a little bit later that I wanted to do dermatology. So as you probably know, dermatology is such a competitive field and requires a lot of research and meeting different people and putting your name out there. And so I felt that I wasn't necessarily like equipped to apply right away because I kind of decided on it a little bit later. And so I wanted to take a research year to first give myself more exposure, be able to get more research opportunities, and use that time to kind of network and get to meet more people in the field. And so I really enjoyed my research year. I worked with Dr. April Armstrong, who was previously at USC and now is the chair over at UCLA. And she does a lot of inflammatory diseases, just psoriasis or atopic dermatitis clinical trials. And so it was really cool getting to do the clinical trials as a clinical trial coordinator because I got to hear about a lot of new medications before they were ever FDA approved. So it was really interesting and fascinating. And I also got to work with six other co-fellows. There was a big army of us, but it was really awesome when it came time to applying because we could all rely on each other and kind of use each other for emotional support during that stressful process.
So you mentioned that dermatology is known to be competitive, so what challenges did you face and what advice do you have for future applicants?
I think just truly believing in yourself. I think because I knew it was very competitive, and I think I would personally get very insecure hearing about all of these like amazing other candidates applying, especially from my own class. I'm like, oh wow, like they did XYZ things, or they are just so awesome, or they're so well connected in the derm community. I think just staying, true to yourself, believing in yourself, and just kind of trying to keep like laser vision in a way to like achieve your own goals, I think is really important. I think I felt like, oh, my scores aren't good enough, or my research isn't good enough, or like I didn't do enough of everything. And so I think I was honestly like my own biggest enemy in a way, until I kind of took my research year and started to kind of take ownership and get more confidence in myself and like what I was able to bring to the table with my application. And I think I'm very thankful for my research mentor in particular, Dr. Armstrong, for helping me realize my own potential because she always believed in me, even when I didn't believe in myself at times. And so I really appreciate her for helping instill that confidence in me to just like pursue my own goals. Like I know what I'm passionate about and just really just go for it.
I've heard very good things about Dr. Armstrong. Even when I interviewed Dr. Nicole Saleme, she mentioned like such great things about how good of a mentor she was in
hmm
her dermatology career. So
hmm
it's good that like you've mentioned how much of an
Yeah.
impact she's had on you in your
Yeah.
career.
Yeah, she really has. She has shaped my career, and I'm so thankful to be in LA. Even though she's not at the same institution as me anymore, I'm
Mhm.
able to still see her at conferences, or we'll catch up and get coffee or something sometimes. And, like with, jobs I'll have to apply for, maybe fellowships I'll apply for. But yeah, it's been really awesome having Dr. Armstrong as my mentor because she really is a big advocate and support for all of us, even as we go ahead in our careers and, apply for jobs or maybe fellowships. Like she's still like a phone call away, ready to support us and advocate for us in any way that she feels like we need.
Now that you're at USC, what's residency like day to day in your life?
Yeah, so I think, with dermatology residency, a lot of it is in the clinics, but I think my program is pretty unique in that we get about 8 hours of dedicated time for learning, academic learning. And so every Tuesday and Thursday morning from 8 to 12, we have dedicated lecture time. So it's either faculty or resident led, and we'll just kind of go through cases, go through different topics, go through different book chapters so that we can enhance our learning. Usually Monday, Wednesday, Friday is full clinic days, and then Tuesday and Thursday we'll have like half half day lecture, half day clinic. And then we also get a lot of exposure to inpatient medical dermatology, which is awesome. We do about 2 months as a second year inpatient and then 1 month as a third year inpatient. And I know it's cliche when people say like, oh, like the stuff you read in textbooks you like see in person, but that's actually like pretty true at USC. Like you'll see like the rarest things happening like pretty frequently here.
Are there any memorable or surprising moments so far in your career?
Yeah, I think there's a lot. I actually just had a career meeting with one of my program directors a couple weeks ago because I just felt so confused because I ended up liking so much more of dermatology than I expected to. I knew I always wanted to work with, more vulnerable stigmatized communities, and I thankfully have the opportunity to work in our LA County system with patients who tend to be a little bit more from like underprivileged backgrounds, so I feel really happy to serve them. I did not expect to like surgical procedures as much as I do. And so I have really loved getting to do excisions in clinic, and suturing. I never thought that'd be an interest of mine, but it's so fun and satisfying to see you close up something and then have them come back a few weeks later for suture removal and see how the scar healed. And I truly never thought that I would like inpatient dermatology as much as I did. My inpatient month was just a couple months ago, and apparently it was one of the busiest months in 7 years of inpatient consults, apparently, but I loved every second of it. And so it kind of changed my horizons in terms of what I hope to do with my career. I think maybe being at like an academic center would help me be able to kind of be able to dabble in all these different interests of mine.
And how do you balance like the intensity of residency with your personal life?
I think it's tough. I think first year was definitely very tough because you're essentially learning a whole new language when you learn dermatology, like what's a macule, what's a papule, what's scale, what's crust, all these kinds of things. And then you're learning a new hospital system, especially like me, when I went to a different medical school and then went to a different place for residency. Thankfully, I had done an away rotation at USC, so I was a little bit familiar with how things worked there, but still, once you actually start the job, it's very different. And so I think being tough what also is tough for me is just being away from home. I'm an only child. A lot of my friends are from my medical school and they are in Dallas still for residency. And so I think a lot of my home base is back in Dallas and I'm here in LA. But I think one of the really good things about dermatology residency is that we get most of our weekends off. And so I'm someone who's like, a flight's a flight no matter where I'm going. And so I always kind of use that as my mentality to just like fly home whenever I want on the weekends, just even if it's just for 36 hours, just to see my dogs, my parents, my friends. It really is like a nice reset for me.
That's good that you get to go back on weekends and it's very balanced. And
Yeah,
you're
definitely. And I live close to work too, so that, I get home quickly and can FaceTime everybody before they go to sleep since they're 2 hours ahead of me.
and now moving from your passion for dermatology and into South Asian skin specifically. As a South Asian, I'm sure you have grown up trying home remedies. Did you or your family ever try home remedies for skin or even hair care like turmeric or haldi masks, coconut oil, or other traditional practices? And how has that cultural background shaped the way you think about dermatology today, or even how it connects to your career today?
Yeah, that's a great question. So, something that's also really drawn me to dermatology is skin of color. I feel like when I was growing up, I would keep going to different non-brown, nobody looked like me kind of dermatologists. And so I feel like it was kind of hard to develop a kind of personal connection with them and kind of have them kind of understand where I'm coming from with my particular skin concerns and how things can really present differently in skin of color. I have grown up trying a lot of home remedies myself. I was a victim of Fair and Lovely. I, had my hair coconut oiled up every night by my mom. And so it's really nice now being a dermatology resident, being in this field, because I feel like when I was growing up, I didn't really see many brown dermatologists out there. And so I didn't feel like I was able to develop like a personal connection with the people that I was seeing for my skin and hair care concerns. Not that I didn't feel heard, but I just didn't feel like there was like that connect or that true understanding of kind of my cultural background and what I'm bringing to the table in terms of what I'm using at home. And so It's really nice now because there's a lot of push for skin of color education, especially in dermatology residency programs. One of my mentors at my institution, Dr. Netta Elbulik, has actually spearheaded a lot of, making atlases and image textbooks for diseases in skin of color because they do present differently. When we see inflammation on more Caucasian skin, it's more red, angry looking, but on brown or black skin, it might look a lot more subtle. And so we just want to make sure we're doing right by our patients and making the correct diagnoses and making sure we're aware that things can present differently in different skin types. And so I think just like some misconceptions about like South Asian hair skincare remedies. Like I think people think coconut oil is helpful. It actually kind of clogs up your hair follicles and kind of prevents new hair from growing. So if you're someone that's like suffering from hair loss or is like, why is my hair not growing back? I'm trying all these different things. Like, if you're using coconut oil, then it's probably not going to help. And turmeric masks, as awesome as turmeric and haldi is, sometimes it can be very irritating to the skin. I know it's very irritating to my own skin, so I kind of stay away from it myself. And with Fair and Lovely, that's been out for so long. I think there's been a lot of backlash for that kind of mentality now in the South Asian community, which I do appreciate that people are trying to speak up about it. And so I think just if there are some concerns about hyperpigmentation, like you have dark spots here and there, we have a lot of other great treatment options, such as hydroquinone, azelaic acid, kojic acid, topical or oral tranexamic acid. So there's a lot of other formulations out there that are safer and can address more of the hyperpigmentation concerns than using just like this Fair and Lovely cream from back home.
I'm glad that I'm getting your insight on this because as a brown girl myself, when I dealt with really bad acne, my mom would tell me to use haldi or turmeric masks to try to
Yeah,
clean it up, or just like
yeah,
different home remedies. And
yeah.
it would just be confusing figuring out what to use exactly. And you don't see that really on social media or anything. It's just like a traditional Indian thing.
Yeah. Yeah. And my mom would tell me like, oh, like put like Colgate toothpaste on your pimple or like she'd be like, put honey on this or something like that. Like it's like none of this is really evidence-based and I don't
Yeah,
think it's really
right.
doing anything.
Mhm.
And so I think it's good to just kind of debunk some of those myths.
And if you had to give three skincare tips specifically for South Asian skin, what would they be?
Oh, that's a great question. So, I think firstly is prioritizing sun protection. We always want to use tinted mineral sunscreens. So, mineral sunscreens are like zinc or titanium or iron oxide based sunscreens. They block more different types of lights. And so, that's really important. And I think people often forget that when you're driving in the car or even like a visible light when you're sitting in a room full of lights, like you can still be affected by that kind of light. And also, the sun can also come through the car windows. So it's really important to use that tinted mineral sunscreen, but equally important to make sure you're reapplying every few hours, no matter if you're inside or outside, until it's time to go to sleep. And then, secondly, I think just being proactive about pigmentation concerns because no matter if we have acne, eczema, or even minor trauma, like whatever it is, we are more prone to getting some dark or light spot wherever that like acne lesion was. And so I think just being on top of, our acne skincare, our eczema skincare, just kind of being mindful of our skin and using gentle exfoliants that it can also have some lightening effects, such as an azelaic acid or a niacinamide can be super helpful. I personally use azelaic acid. I think it's been like a game changer and the holy grail in like my own personal routine. And I think just balancing, wanting that glow and that brightness with also just like protecting the skin barrier. I myself have over exfoliated too much. I'm like, I need to do AHA, BHA, glycolic acid peels, go for a chemical peel, like get a hydrofacial, like do my retinoid every night. And I think it caused me to have some like skin damage and like my skin barrier was broken and I had to like allow for like a month or two for like my chin to heal. And so I think just kind of not being too aggressive with our skincare and kind of simplifying, keeping a minimalist routine. I know like vitamin C sometimes can be a little bit irritating. I know personally I can't tolerate it, so I just kind of stay away from that. And so just maybe, sunscreen, gentle cleansers, exfoliating once or twice a week, and just kind of using like a gentle thing that can kind of help prevent acne and also help hyperpigmentation, kind of like an azelaic acid is a great routine to maintain.
And you mentioned tinted sunscreen. I feel like I really need to get in on that as a brown girl because when I tried other sunscreens, it would leave a white cast on my skin.
Yeah.
I did not like that at all.
Yeah.
So definitely I would use a tinted sunscreen.
Definitely. I personally use like the La Roche-Posay Anti-Helios. I love that one. But I know a lot of people have good things to say about Elta MD or Tizo, Tizo, and Supergoop as well. They have a tinted one too that I've tried before. I have such acne-prone skin, so like it's really hard for me to like try and stick with something. So I'm really glad I've like found the La Roche one because that has been working for me for, knock on wood, about like 6 months now. So
Love Rasika Reddy. That's my favorite skincare brand right now.
yeah,
Is like so.
yeah, it's great.
And Dr. Reddy, do you mind sharing your skincare routine as a brown girl yourself?
Yeah, I've worked really hard to develop my skincare routine because, as I mentioned before, like my skin is so prone to acne. People always say you'll grow out of it, but I'm about to be 30 and I still deal with acne every day. And I get really bad hyperpigmented scars after my acne resolves, like no matter how tiny the bump is. So I'm always trying to combat, keeping my acne at bay, but also addressing the hyperpigmentation concerns, kind of being proactive about it so that I can minimize it whenever it does occur. So for me, I use a salicylic acid face wash in the morning that helps kind of declog your pores and minimize the pore size, and especially is helpful for more comedonal acne. I personally use the La Roche-Posay Effaclar. 2% salicylic acid. And then I will use an azelaic acid moisturizer after that. The 15 or 20% is kind of what is a prescription strength, but you can also get like cheaper ones that are lower strength, but still effective over the counter. I think The Ordinary has one that's like 10 or $12 that you can get over the counter. And that kind of helps with acne and also helps with like lightening as well. So it's like kind of the best of both worlds. I love azelaic acid. And then I put my La Roche-Posay moisturizer on. I use the double toluene repair. And then I put my anti-Helios tinted mineral sunscreen on. So that's my morning. And then throughout the day, I'll reapply my sunscreens. And then at nighttime, I wash everything off with a gentle cleanser. I alternate between the La Roche gentle cleanser and the Cetaphil and CeraVe gentle cleansers as well. And then I have finally upgraded myself from the lowest strength retinol to a tretinoin 0.05. So I'll put that on. Just like a tiny pea size amount is all you need for the entire face. I think that's also something that it has less education online about. Like you really don't need to lather your face with retinol. Like this much goes a long way every night. And then you can also put moisturizer on before or after, or both. I choose to put the tretinoin on first, and then I'll put the moisturizer on after. And that's it for the nighttime, just kind of keeping it simple, hydrating your face before you go to sleep for the night. And then I'll use like a collagen, like the BioDance mask, like once in a while. I'll use like an AHA, BHA, I think the Dr. Dennis Gross peels once in a while, just kind of rubbing it on my face. About once a month, I try to get a hydrofacial. And then every other month, I'll kind of alternate between getting either a superficial chemical peel or microneedling with PRP. Because the microneedling kind of helps with those like more deeper acne scars and helps with the texture. And the chemical peel helps exfoliate, so it kind of helps with like the dark spots and also helps with the texture too.
Thank you for sharing your skincare routine. I know that will help a lot of South Asians who follow this organization and platform, so
Hmm.
it's great. And now moving to professional insights and challenges in dermatology, what are the biggest challenges facing dermatologists or even residents today?
Yeah, so I think I have gone to a couple conferences recently, and one of the hot topics at all of the conferences has been AI and how AI is going to fit into our practice, take over our practice. And so I think right now a lot of people do use AI with like, medical photography or with like note writing. And so I think there's a lot of opportunities for AI to kind of help us in the clinic space. And I think, it can also help with like handouts or like, informational handouts about different procedures, different treatment options, aftercare after a procedure, informed consent forms for procedures. Obviously, you'll have to edit it and make sure the information is correct, but it can supply you with like a draft or a template to go off of, which I think also is a good time saver for a lot of people because like dermatology clinics tend to be very fast paced and busy. So I think there are ways that AI has been and will continue to help us. I think moving forward, there's a lot of like, oh, like diagnostic tools with AI. How can it like diagnose skin cancers, and things like that. And so I think, that's an interesting realm that we'll have to see, will that kind of take over our job of diagnosing? And so I think there's been a lot of push for maybe doing maybe some more procedural things because, AI, doesn't have the hands we have to kind of remove a cyst or remove a skin cancer or, stitch up, reconstruct the face after doing a Mohs procedure. And so I don't think it can really take over kind of the procedural elements of our field, but I think it can aid us in a lot of ways with clinic flow, and kind of helping us maintain the efficiency of a clinic. I think, I'm not really sure how it would fit in terms of kind of taking over our career, as a lot of people kind of speculate and are afraid of. But I would think that, we would still need to be there, like our eyes that we're training, our ability to build patient rapport. I think none of that can really be taken away from AI.
And when you work with patients, how have you learned to build trust with your patients, especially when discussing sensitive topics like appearance or hyperpigmentation, like you mentioned previously?
Hmm. I think just maintaining a friendly demeanor and just being authentic can go a long way. I have personally noticed that body language makes a big difference. Whenever I enter a patient room, I immediately sit down, eye level with them. I think it makes them feel more comfortable too, versus me like standing or hovering over them, talking at them. And I think I ask them a lot of questions at first, just, to get them talking, get them telling me about what their condition is to make them feel heard. I often do a lot of active listening. So I'll repeat back before I leave the room, like, okay, this is what I'm hearing. Is this correct? Is there anything different than what I gathered from what you've said? And so I think that helps them to feel like they've been seen, feel like they've been heard. I take a very good look at their skin. A lot of times they'll tell me, like, oh, like you're looking very thoroughly. And you'd be surprised how many times I've heard people come in and be like, oh, you're the first person to look at my skin. And I've seen a couple other dermatologists. So I think that was a little funny and interesting to hear about. Um, and then in terms of like, working with them for treatment, I always ask them like what their goal is. If it's something that, is like life-threatening or would really impact their health negatively, then like I will be a little bit more aggressive in my recommendations. But if it's something that's more benign, I'll just kind of meet them where they're at. If they don't feel like treating it or if something doesn't bother them and it's like a benign thing, I'm like, okay, like that sounds good to me. I'm not going to push any agenda on them. And specifically for pigment related concerns, I think it can be like a very personal topic for a lot of people since like, like skin color, like how we look can kind of affect our own confidence, how we feel in our communities, how our communities view us, any stigma, etc. And so I think just, being someone of a skin of color, like I think hopefully my patients would want to come to me when I'm in practice, because they can relate to me, and think that, like I, maybe look like them or think like them. And so they feel like they would be able to automatically just kind of open up with me and I'd be able to hear and address their concerns. And so I think, like I would hope that like they would feel safe talking with me about their concerns, and I would be able to just kind of use those same active listening, body language, things like that to kind of make them feel seen and heard.
Yeah, that's very sweet. And you mentioned how you look at their skin very closely. I remember when I went to the dermatologist for the first time, it was the first time I went, and he looked at my skin, but then he just automatically prescribed me Accutane. I felt like he didn't really look at my skin.
Mm-hmm. Take a really good look. Like I pull out my derm light and I'm like scouring the whole face. And even on areas they're like, oh yeah, I don't have rash here, I don't have rash here. Like it's still important to check, especially if they're a new patient. Like you want to build a baseline. Like, okay, I checked them all over. They didn't have this. So the next time they come, if they have something somewhere else, you're like, oh, I checked that before. It wasn't there before. So like this is new. So I think it's really important.
And if you could give one piece of advice to someone starting their journey in dermatology or even a med student considering it, what would it be?
I think finding a mentor. I think for me, finding Dr. Armstrong was such a game changer. And not just like, someone in the field, but also like someone maybe just a couple years older than you in med school who like applied for residency. I've had quite a few mentors like that too. They know who they are. Like they've been so instrumental in my career because, they're like, oh, like, this is how to look good on a rotation, or these are tips for when you're writing your personal statement, or like when you're choosing rank lists or like interviewing, these are things to look for. And so, or these are how to get research opportunities, or I know XYZ person, let me connect you. And so I think just having mentors like me, even just like 1 or 2 years older than me from medical school, has been super helpful. And I'm still in touch with them to this day. Like it's nice to see them, like, moving on with their practice and like being successful in their careers now. But then it's also like awesome for them to be able to still kind of help me and mentor me kind of informally through this process of going through research here, going through residency, and now maybe applying for fellowship too, or finding jobs in the future. So like a big name mentor is great, but also these smaller mentors along the way is also great.
And you've mentioned research opportunities. So, what's next for you in your career? Are there any exciting research projects at USC?
Yeah, so I'm actually about to meet with one of my mentors next week, but I feel like first year I was just trying to like get my bearings, like learn how clinic flow works, like learn a little bit about dermatology so that I would know what I was talking about in clinic and with my patients. Now that I feel like as a second year, I feel like I have a little bit more grasp on clinic and, dermatology conditions and like my study schedule, things like that. Like I mentioned before, like I love community outreach. So I'm getting back in the community. I've reached out to a few different South Asian women domestic who have been victims of like domestic violence groups in the California, Los Angeles area. And so just talking to them about skincare, kind of debunking some of those like South Asian myths that we've talked about before. So kind of just like a Q&A session with them, talking to them about skincare and menopause, skincare and pregnancy, just what things to look out for. Um, and so I think that's really exciting for me to kind of get to give back to the community now. And I've also attended a few laser conferences, and I really love what's going on in the laser world. There's a lot of different medical needs for use of lasers, and so I am starting to work with an organization who helps to bring more scar revision via lasers or microneedling to mental health victims who have self-inflicted scars. And so it's a very early NGO, so I'm trying to help them kind of build their social media platform now. And so I think it's really exciting for me to kind of get to give back at this point.
That's very inspiring what you've done for those communities. Just amazing.
Thank you.
You're welcome. And where can the viewers or listeners find you and your social media?
Yeah, so I actually just started my professional account. And so it's Dr. Rasika Reddy. And so please follow me. I'll be posting about different infographics on like how to use retinoids or what is a retinoid, just kind of basic information about skincare that I don't know if is totally out there, totally clear on the internet, and could definitely use more education even if it already is. And specifically talking about more like South Asian trends too with skincare and hair care products as well. And then just posting a little bit more about like day in the life of me, just kind of as a derm resident, chugging along.
Well, Dr. Reddy, thank you so much for joining us. Thank you for sharing your background, dermatology, residency life, especially caring for South Asian skin as a South Asian myself. It's honestly very valuable input with what you've discussed here on the podcast. To our listeners, we hope that you enjoyed this episode and took away some practical tips for your own skincare journey. Make sure you subscribe, leave a review, and share the episode, and check out Dr. Reddy's content and social media. Thank you.
Thank you.